and welcome to Uptime, the podcast from .med Healthcare Business News. I'm your host, Carrie Stevens. HCB News is free to read, so if you're not already registered, go to .med.com/news and sign up after the podcast. In today's episode, we're digging into the rise of photon-counting CT. With recent FDA clearances for GE Healthcare Scanner and Mars Bioimaging's extremity system, this space is now clearly multi-vendor. Siemens Healthineers has been pointing to the shift for years, but now the question is what changes next? Joining me is Dr. Matthew Fuld, Director of Product Management for the Neotam photon-counting CT portfolio within the CT business at Siemens Healthineers North America. Matthew, thanks for being here.
Yeah, happy to be here, Carrie.
Well, just like I said in the intro, GE Healthcare and Mars Bioimaging both received FDA clearances in the same week, and it feels like a tipping point. So what's changing now and what doesn't?
I think people in the industry are really starting to realize the advantages that Siemens Healthineers has been able to demonstrate over the last 5 years. It's a journey for everyone. This technology has been the North Star in CT imaging for a couple of decades. And to see it grow and see others be able to get into this space is actually a good thing. That means we know that we are on the right track and we've been doing the right thing for the last 5 years. And so I'm excited to see even more conversations from a broader audience of clinicians and even their patients talking about photon counting CT.
Well, you worked on a prototype photon-counting CT. So looking back, what really had to be solved to get from concept to something clinically viable?
It's been an exciting journey for me. I've now personally been doing photon counting since we installed one of our earliest prototypes back at the National Institutes of Health in 2014. So it's a dozen years already. The technology is remarkable. It truly unlocks new levels of information that you cannot achieve with a conventional scanner. Really being able to see the unseen, the spatial resolution that photon counting offers is remarkable. But to get that level of information and level of detail, you have to figure out how to generate a system that will really give you that information without all of the downsides and the negatives. And that was the trick. It was what would be the right detector material to make the technology give you the best performance for spatial resolution versus spectral resolution. How much data can we truly acquire during a scan and transmit to a computer to reconstruct? How do we do that effectively to get the level of detail for images to give us clinical insights? And I would say that was the biggest thing, finding the right material. And Siemens Healthineers has been on that journey since the early 2000s. And we evaluated all of the possibilities from what we ended up choosing with cadmium telluride. We bought a company more than 15 years ago that was able to help us produce the right levels of crystal for that. We've looked at everything else, even the ones that you mentioned from GE and Mars has been doing. We looked at all those, recognized that those were not the right solution to unlock the spatial resolution capabilities that are needed for this technology to have an impact. And we've been able to demonstrate how to take that from a prototype to a reality. And for us, like I said, 5 years, and at this point, 3.5 million patients have been scanned. So it's a remarkable journey. I'm very happy we are no longer in the days of MATLAB code and copying data, plugging them into hard drives. It's real world. It's fast reconstructions in emergency departments today. So it's a phenomenal journey to see where it was and where we're going to go with it.
So right now the conversation is still centered on cardiovascular and pediatric imaging, but where do you see the first real expansion beyond that and what's driving it?
Well, fundamentally, photon counting, especially when you have the capabilities that we do with our cadmium telluride based solutions, it gives you much more spatial resolution. And so in CT, that has always been the goal. When we started, a little over 50 years ago, it was extremely thick slices. People were trying to see an image. The first images were of the brain, and it was these large blocky images. Now we can go and see 0.2 millimeter spatial resolution. And so what do you want to see? What can we unlock with a better picture? Obviously, cardiovascular is a North Star because so many people are affected by cardiovascular disease and have challenges. So being able to see within a coronary, within a stent, be able to deal with patients who have those very small vessels was a a prime first target. Photon counting also enables you to reduce radiation dose quite dramatically, which is why for pediatric imaging, it makes a ton of sense. For moving beyond that, it's taking those things, spatial resolution, reduced radiation dose, spectral information, and better imaging contrast. And we've already seen many use cases that are growing in popularity from neuro and neurovascular cases. So whether that's similar concepts of stenting in the brain or neurodiverters or deep brain stimulation leads, all the way to the unique type of scenarios where I have patients reaching out to me either on LinkedIn or to our website and saying, hey, where can I find a photon counting scanner because I have a cerebral spinal fluid leak and no one else can find it? I've tried MRI, I've tried conventional CT. My doctor can't find it. Where can I go to a hospital that has this so they can find my leak and fix it? Because it's these types of things where if you can't see it, you can't treat it. And that's why photon counting truly is special because it allows us to see things with that zero point 0.2 millimeter resolution that we couldn't see any other way. There are many other examples in body imaging and oncology imaging. We always think about finding the lesion, finding the tumor, and that is the first step. But patients have a journey, right? Once you find it, you have to treat it. And when you go into that next step with surgery, it's the surgeon's dream to have a plan, a map of where they should go, where they shouldn't go, and having a vascular map at a much higher spatial resolution leads to better outcomes. And it's really anywhere that a physician can imagine. How can I utilize seeing better to get a better outcome? And so it's really across the body.
So what are the barriers to implementation? I mean, I'm guessing cost. What can you talk about that?
Certainly. I think obviously new technology usually comes with a cost premium. At Siemens Healthineers, we started with the original Neotum Alpha in 2021, and that was the highest end system that we had on the market. It still remains that way. We have released a new version of it, the Neotum Alpha Peak. But since then, we have already released systems at a lower price point, and we continue to do so and will do so more as the years come to bring that cost barrier down, giving hospitals and physicians options to get into that space. But it's new technology. Companies like ours are trying to invest into develop new technology, push it further, and that costs R&D and development dollars. And so there is a price premium. The crystals themselves are expensive to produce. And so we are building a second full scale factory at Siemens Healthineers in Germany to do that so that we can bring the price pressure down by having more capability because it is our future. By
Right.
2040, that's what we've said publicly that we want all CT to be photon counting because of all of the things that I've mentioned. But the other side of it is take away the cost of the technology. It's getting people to think about what they've been doing for the last, again, depending on how long they've been practicing, uh, 20, 30 years in their practice to think differently. Abdominal imaging, for example, used to be 5 millimeter, 7 millimeter, 3 millimeters, thick slices depending on where you are. They have to think differently. And so I have a team at Siemens Healthineers that goes and works with hospitals to help them with change management. We do it outside of the traditional educational pathway to say, hey, let's look at photon counting differently. Don't operate it the same way that you would a traditional scanner. We want you to get more. We want you to see that unseen. And to do that, you have to start thinking about doing things differently. The other piece is the future, as we all know, and I'm sure you have on your smartphones and things, all of these AI algorithms that help us do a lot of different tasks. In radiology today, the amount of data and the amount of patients scanned continues to go up. And so we face resource challenges, not only of technologists and operators of the technology, but readers and radiologists, cardiologists, pulmonologists, et cetera, to read. So as new AI tools come out, the goal would be to help them with more information. But because we have so much better resolution, not only spatial resolution, but spectral information, we can look at materials. Can AI help us see things that we wouldn't normally have seen? And so open the door to a whole wide variety of new possibilities, new insights that could feed a clinician, giving them that capability to better serve their patients.
Oh, that's excellent. Yeah, I want to get into more of the workforce part. Has there been pushback on the workforce? Like, obviously, learning new skills can be challenging, but can you talk more about that part, the workforce challenges?
For sure. We've been planning for photon counting for years at Siemens Healthineers, and we knew that it would unlock new capabilities, but you have to operate it correctly, right? You don't want to operate your insert favorite car, Lamborghini, Porsche, whatever, like a old whatever. I won't disparage anybody's car in this process, but you want to push the boundaries. You want to be able to turn all the knobs to get the last inch of everything out of it because, again, that's seeing something that you couldn't see before. That's understanding the vulnerable plaque inside of a coronary stent that you couldn't see before. You have to think differently. And so, how do you do that without making something overly complex? Siemens has been introducing automation and AI supported tools for a number of years. One of them is what we call My Exam Companion. It is our umbrella for a lot of technologies, including what we call clinical decision trees. It really takes the inputs. Why are you being scanned? Dear patient, what about you needs to be solved? What was that clinical indication? It then takes the information about you. Are you male, female, size? What's your heart rate? What's your creatinine level? What does the operator who is scanning you want to say about you? Takes all of that information and it pushes the system to choose the best possible acquisition and reconstruction automatically. So it knows all the capabilities of photon counting. It says, hey, how do I tune this specifically for you as a patient to get the most out of it? And that is development that we have been working on for many years. We introduced it as a start in some of our conventional systems to fine tune it, to refine it so that we had that as a support tool, knowing photon counting was coming and we didn't want it to be complex. We want it to be easy. And that's what we've seen. We see scenarios now where technologists who have 20 years of experience and 2 years of experience can be on par with each other because the technology supports them to help them operate at the same level. That way they can focus on the patient. What does the patient need? How do we help them in their journey of this disease process? Because it's scary to be in a hospital. I don't know if you've ever gone to be scanned yourself. You sit in one of those donuts. You're like, what is wrong with me? What is that voice overhead? They want answers. And with this technology, we can do it in a friendly way, easy for them to move forward. So we're excited about that. And for physicians, we offer a lot of tools to help train them. We have a dedicated community at Siemens Healthineers for physicians by physicians. Siemens stays out of it. We really let them have that peer-to-peer conversation. How do we help you be more efficient with this technology? How do you use it to its fullest extent? And those are the things that really are needed to get people over these barriers of the technology, especially when they have less time. They need to be as efficient as possible. If you can get to the answer very quickly, then you don't have to spend as much time in a case.
So I come from a service perspective. I worked at the HTM space for many years, but can you talk about the from photon counting CT from a healthcare technology management service perspective?
Sure. So, the first questions I get from news sites that are thinking about how to do this, they're like, "Oh my gosh, it sounds great. There's so much data, but there's so much data. What do I do with this? And how do I handle this? Will my infrastructure manage it?" And again, we've been very thoughtful in how to deploy this technology in hospital environments. We want it to be successful, and so We have built in that same environment that says you should be scanned this way, you should be reconstructed this way. This clinical indication gives you the need for this type of image, and this other clinical indication maybe needs the most complex, highest resolution piece, and it will do it automatically so that we don't overwhelm, say, image systems. I don't love angry phone calls from PACS administrators who are saying, how much data is this going to create? You know, I think progress requires innovation. And so we see these information systems being able to handle more and more data. All of our imaging systems provide valuable insights, and so the best data that we can send to them again feeds that future of AI algorithms. So we have to deal with the change management with them as well. We're no longer dealing with 4-slice CT scanners. We need all of the capabilities. But Siemens is also partnering with other vendors. For example, Siemens announced about a year ago a partnership with Sectra, one of the largest PACS providers, to integrate our spectral data into their PACS environment. So it allows physicians to be able to, on the fly, utilize spectral information to get the most out of the data without having to open up additional post processing, without having to send additional data sets, reducing the burden, giving them access at their fingertips. And we're working with many other PACS providers to do the same thing. This is what our customers ask us for. How do we make their lives better, make it easier, but don't take away all of the capability that the technology provides?
So, if Siemens' long-term vision holds and most CT shifts to photon counting, what actually looks different day to day in 10 years?
I mean, hopefully that means we find things that we've missed. I've seen many scenarios where, uh, again, things like a cerebral spinal fluid leak where we can't treat a patient. If you have one of these leaks, typically you have a disease called spontaneous intracranial hypertension. That type of patient, if they have a CSF leak, has debilitating pain. They can't work. They can't live their life, spend time with their families. It's horrible. And most of the time, people get 5, 10 different scans and multiple treatments where they kind of stab at the wind to try to see where it's coming from. When you can see something and you can truly know what's the cause, you can treat it and it changes their life. And that's just one indication out of many. You know, if we can use this technology to identify when cancer is going to occur or reoccur earlier, we can intervene, saving cost in the medical system, but also the quality of life for patients will dramatically change if we can see what is wrong with them and guide them towards the right treatment. We are very excited about a future where we have that capability. And if we make it simple to do and we make it easy for hospitals to adopt, we will get there. And then that future where, you know, AI algorithms find what we miss. I mean, I'm okay with that. We'll validate those algorithms. We have phenomenal research partners at many academic institutions looking at these types of scenarios. We want nothing to be missed in the future. And photon counting is a step towards that.
No, that's great. So, the last question I ask everyone is what is keeping you up in 2026?
Really what keeps me up, other than my children who like to come into my room and kick me in the side, is how do we get this technology to more patients? How do we get more people aware of this technology? Which is why I'm happy to be here today talking with you about photon counting, because the first step is really understanding that it's available, whether you're the patient or the physician, knowing that this technology exists, how much it truly can change and be an impact for your facility, for your patients. This is an investment in technology for the future. People only buy scanners typically once every 10 years, and they hold on to that. Now is the time to get involved so that you have the technology as it continues to evolve for the future. And yeah, how do we get it to more people? And we're continuing to find new ways to do that. And it's an exciting time to be in this space.
Well, Matthew, thank you for the conversation and for breaking down where photon counting CT stands today and where it's headed next. That's it for today's episode of Uptime. I'm Carrie Stevens. Thanks for listening. Take care.